I have to say I've been doing headache for a long time, and occasionally you walk in the room when somebody's having a cluster headache. It is the most uncomfortable thing to watch that I've ever seen in my life because it's such excruciating pain.
It feels as though you are being hit by lightning, as if a hot poker has come into your eye and all around the area of the eye. Oftentimes you get stuffed up and tearing of the eye, but the pain is very agitating.
It comes in a cluster, and what that really means is that patients will get into a cluster cycle. They can last anywhere between a couple weeks to several months, typically spring and fall, so when the seasons change, but it can occur other seasons as well. Severe piercing pain, tearing on the side of the headache, both from the eye and a runny nose. And the attacks themselves may last anywhere between 25 minutes, 30 minutes to a couple of hours. Patients may have 6, 8, 10 attacks in a day. They typically wake you up from sleep. A cluster headache used to be associated with a 50% suicide rate because the pain was so intractable and hard to manage, and quite frankly, often not identified, not diagnosed, and therefore ineffective treatment.
Before I came to Dr. Diamond, I had no treatment. I was simply trying to find somebody to help me. Nobody could diagnose me. They are the best at handling cluster headaches.
When somebody's having an acute attack, there are lots of different options. A real simple one is oxygen. You can't do it by a nasal cannula. You got to wear a mask, lean forward, and breathe high flow oxygen for about 10 minutes. That actually helps about 75% of patients. We do something called IV histamine, which is an old treatment for chronic cluster, but it's very, very effective and really useful to our patients.
We have done many different types of medical treatments and very cutting-edge treatments like biofeedback. I've had years and periods of time where I have not had headaches, and then I have periods where I go back into the headache pattern.
We have a rule at our clinic: if you have cluster headaches and you go into cycle, call the front desk, tell them you're a cluster patient, and they will get you in within 24 hours, because that's how drastic it is and how important it is for patients to have access to therapy.